looking at his pulse ox, he's still 95. He's still doing good. Okay. Okay. The next thing I do put on my sterile gloves. Usually in these kits, they're not in a package, you know. They're just kind of there. You just gotta try to figure out which one it is. Okay. So remember, on your sterile field, these gloves are usually a little shorter. If you're bringing in your own, they're probably a little bit longer. Okay. So I only can go in how much? That's it. Okay. And sometimes you can't. Sometimes you can't. If that has touched my skin, I can't touch it anymore. Okay. So now, what's inside my kit? See, I have one. Usually, you don't have enough gauze. We're gonna do a little bit different from the video. Okay. Remember, I need to do what? Go around, because I'm gonna use that kind of last. Okay. These are my pipe cleaners. Okay. This is my string that I'm gonna change the tray collar with. Okay, just kind of throw that on there. I'm gonna use this probably first. These little cotton tips I'm gonna use to clean under the plate. Okay, I do have another pipe cleaner here. Okay, so I only have about 4 gauze in here. Okay, so I gotta be a little bit mindful how I'm gonna do it. Because once I clean with these little cotton tips, I have to dry it. So I'm gonna take a gauze and then I'm gonna turn it over and then do the other side. Okay. Another thing is you wanna make sure if you don't have a bag, if you didn't bring a bag in with you, you can use this as your dirty. You can use it as your garbage. Okay. All right. So now I'm ready to get started. Right now I need to pour my saline. And if you notice, this only has 2 compartments. We don't have those nice 3 compartments like on the video. So I'm going to pour, and we're never going to use what?
Hydrogen peroxide.
We're never going to use peroxide. Okay? So I always want to make sure that I am where I want mine, so I won't turn my back on my sterile field. Okay? So the first thing I want to do is, I want to go ahead, I see he's still 95, he's still doing good. I want to go ahead and take my oxygen off. Okay? So now this hand is not sterile anymore. This one is, okay? So the first thing I need to do is I need to take the inner cannula out, okay? In a real person, it will go down. The mannequins go up, okay? But in a real person, they go down, okay? I'm gonna drop it in here. I'm gonna get my brush, okay? Yes, you can go like that. You know how she wet her brush in her saline, you can do that, okay? You want to make sure you don't do that though, okay? Okay, so you want to hold it, and you want to clean it, okay? And you want to try to go underneath, okay? Making sure your sterile gloves does not touch anything, okay? So when I'm done with that, I'm going to drop it in here, and I'm going to throw this away. Okay, so just let it rinse for a second. Okay, I'm going to pick it up. I can take my pipe cleaner. Okay, pick it up. And I want to get some of that wetness out of there. Okay, go here, throw away. Go here. Go away. And I got one more. I can clean on the outside if I want. Okay? The object is you don't want water inside of the inner cap because it'll go down. Okay? Now I'm going to put it back. Okay? So I'm looking at my patient still doing good. Okay, now I need to clean with those little cotton tips. So I'm going to take both of them. I'm going to take my saline and I'm going to pour. Okay, drop one onto this field. Now you can either do this one or 2 ways. You can go from the top and go across, and then do the bottom. Okay, or you can go to the side like I like to do. Okay, so I'm going from the side down, throw it away. Okay, now I need to do the other side.